This week's Ask Dr. Durie is in response to questions from many patients, actually, who want to know the details of a trial called the Determination Trial that was presented at both the ASCO meeting in Chicago and also the EHA meeting in Vienna by Dr. Paul Richardson from the Dana-Farber. The results were also published simultaneously in the New England Journal of Medicine, so you immediately have the impression that this is certainly an important trial and people are very interested in the results. So this study was a large study in which half of the patients were treated with early autologous stem cell transplant versus delayed transplant, meaning that transplant would be offered to patients later in the disease course. All the patients received initial treatment with Velcade, Revlimid, and dexamethasone. Half received this early autologous stem cell transplant, and all the patients received lenalidomide, Revlimid, as a maintenance therapy. The results are rather clear-cut. There is no doubt that the first remission, what's called the PFS or progression-free survival, is significantly longer with the initial early autologous stem cell transplant, over a year, in fact, longer, with the early autologous stem cell transplant versus not. However, there is significant caution because at follow-up at 5 years, the overall survival is basically identical at around 80% in both arms. Now, as it turns out, these are the exact same results which came from an earlier French trial conducted by the IFM, in which remission was prolonged, but overall survival in that particular study continues to be the same for both arms. So the bottom line is that this has really reactivated the discussion about what is the role of autologous stem cell transplant as early treatment for myeloma. Obviously, the longer remission is a clear benefit and is something favorable for the patient, but balanced against having to actually go through a rather rigorous procedure, although it has become safe and is now relatively inexpensive compared to many other treatments that we have to offer. But nonetheless, the fact that it does not confer longer-term survival benefit is a caution. And so I think that most investigators are recommending that particularly for younger patients where we would normally be offering autologous stem cell transplant, that they sit down and have a shared discussion process with their treating doctor or doctor to see what is really the best in the case for them. That having that solid first remission for over 4 years, moving towards 5 years, is that something that they really want to have, or maybe defer that transplant and look to possible benefit from the many other exciting therapies that are available. And so an unresolved question from this determination trial, although clear response and remission benefit with the early introduction of the autologous stem cell transplant.